All right, let's go back to the Instagram post. Go back to IG if you haven't seen it. Quick clip that's titled Aerobic Systems, talking about CO2 and aerobic. Now, that was an hour and 15 talk. This one's going to take a little bit of time to put context to what was being said in that clip from the presentation. Now, there's a lot of words that were being thrown around there. When I watched that, I'm like, this is what's missing. It's the linkage to all those words. That's what happened in the whole talk. Let's start with the first word being maybe one of the scariest, and I get yelled at all the time, I'm not allowed to use big words, is acidosis. And that's a very important word. Now, it's not to be confused with significant medical pathology, significant medical emergency of metabolic acidosis. You could also have alkalosis. And basically, this is a commentary on the pH of the blood. Acidic is a lower, basic is a higher pH. That'll actually come in to some other things that we'll discuss here. Now, acidosis is crucial because it is a factor that is absolutely necessary for some adaptations that are very, very desirable. It is also necessary as a byproduct from training in very, very effective means. If you're gonna run fast and lift hard and et cetera, acidosis has to be a part of that process. So when we talk about an EPP, keep your friends close and your enemies closer. So basically this is a shift in the blood that is acidic. Now, why does that happen? When you start to use certain energy systems that have byproducts, they have cost to them. Well, one of those costs through glycolysis is the generation of lactate and hydrogen ions. If you put those two together in this other world, that's maybe where you can get lactic acid. However, they're two separate entities in the result of this energy system development. The lactate is your friend. You can use that for more energy. The hydrogen ions is what makes the blood a little bit lower. When I say lower, and we know that 7 is right in the middle, we're getting into like the very, very high 6s. We're not getting into 2 or 3. That's not at all what acidosis, even metabolic acidosis as a medical emergency would fall, okay? Sometimes we want it, sometimes we don't want it, but we have to have it. And then when acidosis is prevalent, maybe if you don't even know how it's affecting your body, because acidosis can also come from other means other than physical development, then there's typically a couple things that happen. Number one, your muscles cannot generate as much force. Under acidic conditions, muscles do not contract as hard. That's important. It's why rep 8 and 9 are harder to move the dumbbell than reps 1 and 2. That's very, very important. And number two, the acidosis creates a sequence of a whole bunch of other things happening that makes muscles feel tight. And when they're tight for a long enough period of time, then you may develop different types of changes in the connective tissue. That can happen. There's a whole bigger story that you can see. A lot of this does come out of EPP, but I've said this for many different places. If you pull blood from a trigger point, and a trigger point that meets a certain definition, then that blood is typically acidic. So those are things that can happen in an acidic environment. Lastly, with acidosis, motor skill precision changes. So if you're usually 10 out of 10, throw a whole bunch of acidosis into the system, you're going to be 7 out of 10. Those three topics unto themselves could be a big talk. But now we appreciate that acidosis is a major factor. Now, that in itself was a big word, but now we know what it means. Now we had other words. We had other words that linked were breathing. We talked about sympathetic, the sympathetic nervous system, which is one component of the autonomic nervous system. We talked about O2 and CO2. Obviously, they were in the title of the talk, okay? When there is a prevalence of CO2 in the system, that is akin to an acidotic condition. So when you find that there's acidosis, then you will find that typically CO2 pressure is higher. Now, what does that do? The big message that missed in that Instagram post was that the draw to breathe oxygen, it has nothing to do, like the urge that you have to breathe after you hold your breath is not driven by the need for more oxygen, it's driven by high levels of CO2. So that is where does oxygen, where does aerobics fit? Because as you remove CO2 in a normal fashion, you can then drop acidosis. You can kind of bring it back to a normal piece. This is where the suggestion that breathing has a parasympathetic effect, which is correct. We've seen that breathing alone under certain environments can create significant motor skill changes. Well, the physiological drive behind that is as you get rid of CO2 from breathing, then all of a sudden you can then change this. And this is driven by this. And there's going to be a whole lot of arrows up here real soon. Now, here's the opposite of what this happens, what I was trying to get across. When you are breathing heavily, when breathing goes up, because that's the normal consequence to get more oxygen when you're training hard. At some point, your breathing has to keep up with the pump of the heart as heart rate increases. So increased breathing is a part and parcel impact with the sympathetic nervous system. When your sympathetic nervous system is being driven by any reason, whether it's physical activity or a bear is chasing you, that's what's the sympathetic nervous system, fight or flight. There's a bear chasing you. You start to breathe heavier. It's where sometimes, if you've seen me speak in person, if you start getting real close to a person and making them really, really uncomfortable, their heart rate goes up, their blood pressure goes up. All of those things is what's triggering the sympathetic nervous system. So then you start to breathe more. And when you start to breathe more, and then all of a sudden, you are not keeping CO2 to drive slow breathing. The CO2 is being driven out and driven out and driven out. Now you run into the Bohr effect, which would suggest that with an excessive loss of CO2, the blood goes basic, and then it's like this seesaw of metabolic demand. Again, that's a whole nother piece. But you can see there's this really big link into everything, where all of a sudden, if you can maintain lower breathing and still do the activities that you want, I would suggest that's probably impossible. What you can do is create a level of efficiency of all of your energy systems that you can do more work, harder work, more explosive work, etc., while still relying on oxygen and the oxygen-using energy systems primarily. So for instance, somebody that is not undertrained but less adapted to using some of these systems. So you're going to do a 1-minute sprint on the air bike. Someone who's less adapted to what I'm trying to explain, they're going to breathe more, they're going to have higher acidosis, they're going to be triggering some of these more costly changes that have to be recovered from. There are ways to train so that you can do the same sprint at the same speed and cover the same distance and have less of this, because you have trained specifically to do that by understanding how we can use different protocols to take more advantage of this and be able to tolerate more of this. When you can tolerate more of this, you don't have to do this as much. When you don't do this as much, you don't drive this as much. Now, you see that didn't get across in the clip. That's why I wanted to bring to here. Something else to consider. Some of the tests for internal impact, internal load. You always have multiple ways to test things, stuff that happens inside the body and stuff that happens outside the body. So I gave you that air bike test, and basically we're going to measure how much distance you can cover in a certain period of time as a metric of when you had to gas out because there was too much acidosis and you could no longer generate, or your heart rate became so high that you could no longer tolerate some of these things. Another way to do that, to how well can you tolerate acidotic and or sympathetic conditions, is how long can you hold your breath, meaning you're building up CO2, building up CO2, building up CO2 until you're driven to take the next breath. So if you can hold for a minute, you will have higher levels of work capacity potential than if you can only hold your breath for 30 seconds. There's different ways to test for this. In that presentation, that maybe it's on the Perform Better app. I don't know if they put it up there or if they put it up there yet. We talked about the BOLT test, the body oxygen level test. There's other CO2 type of tests where it's a series of breaths and then you hold for time. But what we're looking for is a marker, a metric, a proxy for the longer you can hold your breath and build this up and not have to do this. This is a great sign of your tolerance for these high-cost energy systems. This is not an energy system. This is a nervous system consequence that pushes you to use certain energy systems that have higher cost. This is a big circle, and I could probably draw more arrows and make it look even more complicated. The point is that whether breathing can help us do things that are very, very easy, that have low cost, but we can harness it because breathing and oxygen and CO2 obviously all go together, but it may not always be as clear as to how breathing CO2 and oxygen, keep mixing that up, how that relates to more of these metabolic, respiratory, metabolic, everything is linked. But that's where we were trying to get that across, where energy systems have different costs. And if we can figure out a way from multiple directions to use this more often, then all of a sudden some work capacity, in theory, will increase. And then once you have high levels of work capacity, you should be able to do more of anything. More quality reps, more quality sets, more quality weeks, more quality phases, more quality minutes on your bike or erg or whatever it may be. And it all tracks back to this in terms of a combination of both central and peripheral cardiovascular adaptations. This is primarily focusing on central mechanisms because that's where the heart and lungs are part and parcel for the central cardiovascular mechanisms, and then how that drives with the nervous system, and then how the humoral system then affects those three things, which was strength, accuracy, and then tissue quality, tissue tension, which can then become painful when there are trigger points. Again, totally ridiculous that anybody would suggest trigger points don't exist. There's clear as day research that shows that this is something. I even remember presenting in London a long time ago where certain models from London would say trigger points don't exist. I said, well, what would your guy call it? What would he call it? They'd call it a neurological phenomenon. Fine. High acidotic conditions cause neurological phenomenons. If it's not a trigger point, call it whatever you want. Trigger point, a twitch response, very tender, a very common referral pattern. All this is how you objectively describe a trigger point. It's not just stick your thumb in their trap. It has to have certain standards for it to be a trigger point versus a tender point, which is probably something that's very, very often confused. So anyway, this is the link here that we're talking about in the Instagram post, CO2 versus oxygen aerobic systems. Any more questions, put it in the DM on IG, or we can look at the emails through the website.